My name is Jim Dieterle. I'm Senior State Director of AARP in New Jersey. And, for those of you who see daytime television and you see all those ads for AARP, supplemental Medicare insurance and all that kind of stuff, that's not the AARP that I work for or that we deal with. That's a subsidiary, and they try to do good products and services for our members. And it's a good thing because it means I don't have to do any fundraising, because their mission, the subsidiary's mission, is to offer good products and services, and anything they make on it goes to the nonprofit. So the nonprofit is the 800-pound gorilla, they say, in Washington, D.C., but it's also a state office in every single state of this country, as well as Washington, D.C., Puerto Rico, and the Virgin Islands. And our mission, the nonprofit's mission, as well as all of AARP, is to improve the quality of life, enhance the quality of life for all as we age. And while, as you probably know, our membership starts at 50 and older, or we like to say 50 and better, we have members that go over 100 years old, and we have millions and millions of boomers. In New Jersey, we have more than 1.4 million AARP members, and we're talking more than 50%, more than half of everyone in New Jersey who's 50 and better is a member of AARP. And we're thrilled about that because it does give us some heft, some power to make it better. That's our little slogan at the bottom, AARP, the power to make it better. And we do that by working collaboratively with leaders in Congress, as well as in the state legislature, as well as in the executive branch, trying to pass laws, trying to change regulations, trying to really make it better. And right now, as you no doubt know, the big focus is on healthcare reform. It is huge. And the AARP Board of Directors, which are all volunteers incidentally, recently determined that for AARP we would focus on 6 key healthcare reform asks. As Congress is moving towards issuing legislation on healthcare reform, we said, well, we want to have guaranteed coverage for people 50 to 64, and we certainly want to close that donut hole in Medicare Part D, that prescription drug benefit where after you had a couple of $1,000s worth of coverage, you reach that donut hole and you have no coverage until a couple of thousand more out of your own pocket, and then coverage continues. We want to see if we can get the FDA to approve generic drugs for these so-called biologic drugs, these high-tech drugs that cost thousands and thousands of dollars to take and yet can make the difference if you have cancer or if you have other serious diseases. And we also want to get a new a new federal law that will help in Medicare stop the over 20% of Medicare patients when you go into a hospital for something and then you get discharged. Do you know that more than 20% of people discharged when they're a Medicare patient end up being readmitted to the hospital for the same problem that they were there in the first place? It's really costly, these readmissions. In New Jersey, 22% of our citizens were re-hospitalized within 30 days. So this is a big problem, and there are ways to solve this problem and save a lot of money if we could get a new federal law for healthcare reform. And we also want to see if we can get increased funding for home and community-based long-term care. We know by doing research with members just like you that one of the things you really want to avoid is being forced into a nursing home. If you need long-term care, you want to stay in your homes and communities. And there are ways to do that, and there are ways to save a lot of money. In New Jersey, about 80% of long-term care money last year was spent on nursing home care, and 20% on home and community-based long-term care. And yet we know that when we survey you folks, you say, please, I don't want to be forced into a nursing home. And finally, we want to help low-income Americans in Medicare afford the prescription drugs and health care that they need. So those are six very big asks